Hi, I'm Mary Van Buren, President of the Canadian Construction Association. Today, joining me for our discussion on best practices in COVID-19 are corporate members and also representatives of FOMAC. And FOMAC is the Facilities, Operations and Maintenance Association of Canada. Now, they may not be as well known as a sector as road builders. They do play a very important role in the defense of our country, for example, by building and maintaining Canadian bases across Canada. So I'd like to introduce our panelists today. We have Jim Landon, who's the President of ATCO Frontec. We have Natasha McLean, who is the Managing Director of the Canadian Business Unit of Serco. And we also have Christina O'Donnell, who's the General Counsel and Director of Legal at McDonald Limited. So for those of you who may not be familiar with FOMAC, Jim, maybe you could explain a little bit about what the mandate of FOMAC is and what your members do.
Sure, Mary, thanks very much for the introduction there and giving us the opportunity to talk about FOMAC. FOMAC was actually founded in 2005, and it was founded to serve as an arm's length advocacy organisation for a range of contractors who provide operations and maintenance to military and government facilities across Canada. There was a bit of a hiatus for a few years, but then we reformed recently in May 2019. And our members currently include ATCO Frontec, as you mentioned, from which I represent, McDonald, Canadian base operators, Serco North America, and the Canadian Construction Association. And we're also inviting new members to join us at the moment. Our core objectives I can really summarize in four things, I think. We exist to promote Canadian facilities maintenance and operations contracting to the government of Canada and advocate for greater use of the private sector throughout those operations. We also advocate on specific issues which affect us particularly, such as security clearances, where we look for greater harmonization of procedures and also look for ways to speed up the processes. We also liaise with the government on terms and conditions of contracts. We talk about risk profiles, and we look for opportunities for continuous improvement to help both sides. And lastly, we help our members to understand changes in government procurement procedures.
Thank you, Jim. That's quite a large mandate and certainly echo many of the things that CCA is also working on. So COVID-19 has certainly upset all of our lives. The way we used to do things no longer is the way that we'll be doing them in the future. So Natasha, maybe you can talk about some of the challenges that Circo has faced and how you've adapted to COVID-19.
Sure. Thank you, Mary. First of all, it's a real pleasure to be here today, so thanks for the invitation. To address your question, I think I'd break down the areas of challenge that Circo has faced into three distinct categories. First and foremost, of course, is health and safety. This is a new world, as you mentioned, for all of us, and the health and safety of our employees and the customers that we serve is our top priority. Our business and all of us in this association are in the business of providing essential services to military and government customers. So our employees work in areas like air traffic control, facility and utility maintenance, firefighting, janitorial services, and many others. They're on the front lines, and we take every measure to make sure that they are protected. It has been a massive challenge and a massive effort for us to stay current and updated on provincial and federal government protocols relating to the health and safety during these times. And it's not only making sure that we follow the guidelines that are introduced, but we have to adapt our current work practices to ensure that we meet the requirements for things like physical distancing. We need to provide support to employees who now find themselves working from home. We need to introduce new PPE, personal protective equipment, to make sure that people are safe, and adopt protocols like segregated teams approach for some of the essential workers, and many, many more. We've found a number of ways to try to improve the safety of what we do in order to address this pandemic. One of the challenges we've also faced, along with many others, is around procuring some of the supplies that we need in this day and age. So making sure that we have masks, gloves, sufficient levels of sanitizer and cleaning solutions has been a real challenge. And I know I don't just speak for Circo in that respect. We do engage in a very high level of coordination and communication with our employees across Canada. And quite frankly, for us as a global company, we coordinate across the world to bring the best practices and make sure we're making the right decisions for health and safety. So that's really one of our key challenges. Mary, one of the other key challenges that we're faced with is around productivity. Again, we do provide essential services in many locations. We have a contract at Five Wing Goose Bay where we provide a lot of the services at the base there, and we're committed to ensuring that the base remains operational and that we continue to deliver as many services as we can. And while our employees across Canada have certainly been asked to go above and beyond in this current environment, we constantly have to work to mitigate productivity challenges relating to absenteeism. People are quarantined, people are isolating, unable to come to work. So we have to be able to address how to keep delivering services in that environment. The other health and safety protocols I mentioned, physical distancing, guidelines, and other PPE and protocols. I mean, the reality is that it takes additional time these days to perform work with all these extra safety measures. It takes more time to make sure our employees are properly protected. It takes more time to make sure the surfaces and the equipment that we use are cleaned down on a regular basis. And really, I'm sure we can all understand this. The additional protocols have changed our approach to work, and it's quite frankly changed the time that it takes for us to do the work. And I think as a society, we don't even yet understand the long-term impacts of this. In terms of productivity, the other area that impacts us is travel restrictions. For accessing remote locations, for moving employees in and out of workplaces, we now have to respect different protocols and make sure that we are respecting 14-day isolation requirements where those are in play. So in some cases in our industry where we have work rotations, we may require longer turnaround times. In any event, we add additional complexity, additional resources, and there's more cost to doing business. Which leads, I think, Marion, to the last categorization of the challenges we have, and that's really the business economics of what's happening these days. For essential work that we do, we face additional costs for all of these things that I've already mentioned, for the safety, for the PPE, increased cleaning, additional labor costs, and overtime costs to cover employees who are unable to come to work. In our non-essential work areas, you know, in some cases there's been delays in work, and in some cases there's been complete stoppages. So unfortunately what that means is that our employees in some of these areas have been furloughed in recent weeks. This has been an extremely difficult situation for many members of our team. And while we always try to reassign people or find additional work, in many cases there just isn't any additional work for us to provide with those employees. So like so many others, we face reduced revenues, lost revenues, delayed revenues, increased costs, and a very high degree of uncertainty about what might lie ahead. So I think in the end, with all these challenges, we're going to need to remain very flexible as economies reopen slowly across the country. Serco and all of our FOMAC partners are organizations that work in multiple jurisdictions, and we meet multiple sets of rules, multiple requirements, and provinces are going to open up at their own paces in a way that makes sense for them. So it's going to be very challenging, and you know, we hope that our customers and ask that our customers continue to work with us to understand the impacts of this pandemic, which are far-reaching in so many ways. For us at Circo, we do take a lot of pride in being a trusted partner to our government and our military customers. So we continue to adapt. We're going to keep going despite all these challenges. And looking into the coming weeks and months, I think the only thing we can all say with certainty at this point is that we'll continue to face these issues head on, and we will strive to deliver exceptional services in whatever new normal we find ourselves in. So thank you.
Thank you, Natasha. And I think that's certainly a recurring theme of how well the industry has adapted to the new protocols, how stringently we're applying those protocols, and how carefully we're looking at what the protocols are across each province, each municipality. And I know in CCA's case, we're updating our resources on our site daily to help all of our members adjust to these new realities. And I guess I also want to say I'm really inspired by how the industry has also donated a lot of equipment. PPE, you mentioned the shortage for construction, and yet the industry has been very generous, ensuring that the frontline workers are safe and have that equipment as well. So it's very inspiring to see. So Christina, talking about Black and Mac and hearing some of the challenges that Natasha has talked about, what would you like to add in terms of how your organization is adapting and to this new world of social distancing?
So I was going to talk a little bit about safety, and at Black and McDonald and Canadian-based operators, the safety of our workers as well as others utilizing the client's facilities is always of paramount importance. So when COVID-19 started to expand within Canada, we've created a working group to develop an overall company safety plan to ensure that our workers and others utilizing facilities would be safe in light of the pandemic. There was an overall strategy created, and additionally, we looked at each individual facility to ensure that site-specific pandemic plans were put into place. One of the first measures that was implemented company-wide was requiring all workers to complete a daily fit for duty form. The form asked employees to answer questions about their health if they were experiencing certain conditions or symptoms that are consistent with COVID-19. At the time, out-of-country travel was still permitted, and we still ask the question if employees have traveled out of the country, as well as if they've been around anybody that tested positive for COVID-19. These forms are completed before each shift each day and are reviewed by HR. If any risk condition has been checked off, the employee is required to stay home for 2 weeks if they've been around somebody or been out of the country, or until they're cleared by a doctor if they have symptoms consistent with COVID-19. We also quickly implemented steps to try to ensure that workers were as not exposed to the virus as could be. So we looked at each individual person and determined whether what they were doing is something where they were required to be at the office or site, or whether it was something that they could do from home. For those that were unable to isolate from the safety of home, we tried to put them onto rotational shifts. So there would essentially be a team 1 and a team 2, and schedules were created to ensure that the two teams never worked the same shifts, in an effort to ensure that if somebody on one team got sick, that there would be another team that would be available and healthy to continue performing the work that needed to be performed. And in other cases, we determined that it wasn't possible, and that employees were going to have to work together, and the team 1, team 2 wasn't possible. So we had to address each job, each facility individually to come up with the best plan. Once the plans were created, the plans were communicated to employees through site safety talks, as well as webinars that the company developed and put out for employees to watch. On site, in the various facilities, we make efforts to ensure that there's physical distancing, but this isn't always possible depending on the nature of the work. As was previously mentioned, PPE is challenging to get right now, and we need to ensure that we continue getting the PPE necessary to ensure our workers and others in the facilities are safe. So we actually have established an internal committee that their task is to ensure that we have enough PPE to continue working safely. And they look at every day to make sure that all the facilities have enough PPE to keep workers safe and the facility safe in light of COVID-19. They make sure that we have enough hand sanitizer, enough cleaning supplies, enough masks and the right type of mask required for the work, as well as gloves and safety goggles that may be required for the work. Given that PPE is in short supply, another component of our pandemic safety plan that we have in place right now is communicating how to use the supplies that are given. The two supplies that we find are in very short supply are N95 masks and surgical masks. We have to use N95 masks when we're working in long-term care facilities and hospitals right now. In other facilities, generally surgical masks can be used when employees are going to be working less than 6 feet from other workers or from members of the public or the client. For both types of masks, we've communicated to workers the importance of not contaminating the mask once it's been put on, and they're encouraged to be very careful to avoid contamination and only use one mask a day. If, however, the worker is required to go to a different facility, or if the mask is contaminated, then we provide the worker with another mask. And that essentially is what we're doing at Black & McDonald and Canadian-based operators to ensure the safety of our workers as well as members of the public and of course our clients.
Well, thank you for sharing those best practices. The industry has really come together to ensure that we learn from each other and that we make the industry as the best safe as possible. So Jim, I'm going to leave the last word to you. Canadians have really come together well to help flatten the curve. We're seeing good progress that way. What are some tips you might share as we move into recovery in terms of being productive and safe?
Thank you, Mary. And I think it's really an interesting phase that we're going to go into now, where I think it's really going to be all about confidence, about consultation, and about communication. I think, I read recently somewhere, and I absolutely agree with this, that opening up is going to be much harder to do than it was to close down. Closing everything down was relatively simple. Opening things up is a far more complex affair, and it requires a lot more of that confidence, consultation, and communication, I think. When I say confidence, I think it's all about confidence that we can operate safely in what will be the new normal, because we're not going to go back to the situation that we were before this all started. The new normal is still going to, I believe, include a lot of the measures that we're taking now. So there will still be a requirement for all of our people to self-analyze and self-report each day. Am I fit to go to work? Have I been in contact with somebody who may be infected, and so on, as was described earlier? We're still going to be using PPE, perhaps even more than we are now, and consumption rates could go up much higher. We're still going to be doing physical distancing or social distancing from each other and staying 2 meters apart and so on, because the virus is still going to be around, even if we've managed to dampen it down significantly. And I think there'll also be testing in many different formats. And some of it might just be temperature testing, but others could be actual COVID virus testing, so that we can build the confidence in our clients and in our workforces that it's safe to go back to work. So I think confidence is the first thing. Secondly, I think consultation is really important. As provinces and the federal government and businesses do their planning for how to conduct the open up, which measures to lift and when, I think it's really important that there's consultation of all of the different stakeholders. It's really important that every plan is thought through to the finish. have we actually got everything in place to be able to make this work? I was talking recently to another industry partner who have industry in China, and he was saying how a lot of factories had reopened there. The workers had gone back to work, and everyone was very happy. And then they found there were no orders because the rest of the world hadn't opened up yet, and so they had to lay them all off again. So we're all in a chain, and we're all interconnected in one way or another. And so you do have to think all of that through. I think the other part in consultation is that our customers, I very much hope there will be flexibility in their performance expectations as we ramp back up again. We're not going to be able to go from zero to hero at every site overnight. It's going to take us time to get the workforce back, to get ourselves back to doing things. And as I say, with all of those measures still in place, it's still going to be a bit less efficient than it was before. So it's going to take a little bit of time. And I think there should be realism in performance expectations. And lastly, key to all of it, just as it is now whilst we're still in the crisis, is communication. And it's really important, I think, that we communicate, us, the service providers, with our clients and with our workforces, so that everybody understands where are we, what are we doing, what's happening next, what do we expect of each other on each side, so that everybody can work safely together. It's certainly going to be a challenging process, I think, to get back to productivity in a new normal, but I'm confident that we can do it. I think we've demonstrated as an industry that we can cope with challenges like this, that we can understand them quickly, that we can collaborate together, and that we can come up with plans that work. So that for me is it, the 3 C's of confidence, consultation, and communication. Mary.
Thank you for sharing those 3 C's. Makes it easier to remember for sure. And for those of you who are interested in joining FOMAC, please contact Liam Daly. That's ldaly at cca-acc.com. And CCA is continuing to advocate on behalf of all of our members, and certainly encourage you to follow us on Twitter and contact our resources daily so that you can see and share in the best practices. So I want to thank you very much, Jim, Natasha, and Christina, for sharing the best practices and how your firms are adapting to COVID-19. All this information really helps the industry as we make our way through the pandemic now and as we prepare for recovery in the future. So thank you very much.